Hi, everyone. A warm good afternoon to all of you. My name is Dr. Gauri Kulkarni. I head the medical operations at MediBuddy, and I'm a family medicine specialist. Today, we are going to talk about a very important topic because I see a lot of people around me who are, having to take consultations either online or offline for simple upper respiratory infections, and we are seeing a lot of them with positive influenza or COVID reports. And it's important that we talk about these diseases, understand what they are again. So I will give you a brief gist about what are the current updates on the COVID-19 infection, the latest variants, as well as the H3N2 infection. We'll go into a little bit of details on the symptom presentation, the management, diagnosis, and management of these diseases. And I'll then open up the floor for questions because I'm sure that there are a lot of them that you may want to ask. And it's important that I try and answer them to the best of my abilities. So do type in your questions either in the Q&A section so that, I would be able to take it up one at a time, right? So let us begin. I think everybody's reading in the newspapers. I think I have got a lot of people who have called me and, are very worried about the latest COVID variant, right? So let us start with talking about what is the latest variant that we are seeing and what are the, what are the changes that are being seen, according to WHO. And then we will go ahead into a little bit about symptom presentation as well. So, into the basics, right? I mean, of course, we know that we have seen multiple waves of the COVID-19 infection, and we have seen, a different variants, which we call as variants of concern, right? In the past few years, we had the alpha, beta, we had the large delta variant, which caused a lot of, affection all over the world. Then we had the Omicron, which is still the variant of concern even now, right? But the current state that we are seeing there are a couple of variants within the Omicron variant, which has been categorized under what is called as variant of concern, and they are being focused on, right, because of the because of the way the presentation of the illness is because of this particular variant. Now, when I say that, right, when does a particular virus, now viruses are normally viruses do change. Okay, we have to understand that viruses have that is how they live, right? The way a virus lives is by changing themselves, right? Every time that they undergo a mutation, because they are multiplying, and every time they multiply, they mutate, and every time that they mutate, there would be new variants which are formed. This is normal, and this is true for every virus that we see around. We have to understand that. Okay, now when the variants that are formed, when do they get classified as variant of concern is when, or variant of interest before variant of concern, is when either their transmissibility is changed, or their severity of illness that they cause is changed, or they can defy the usual diagnostic tests that are available, right? That is when a virus becomes a variant of interest or concern, right? So currently, the largest variant of concern that is being taken up by WHO is actually the XBB.1.5, right? But in India, we are seeing a very specific variant, which is the XBB.1.16, okay? Now, this particular variant, what is being seen in the last 4 weeks or so, is that most individuals in India are showing this particular variant, yeah, and that is a cause of concern because it means that it is highly contagious, that it is spreading so much that about 60% of all cases of COVID that were seen in India in the last 4 weeks odd have been because of this particular variant, which is the XBB.1.16, right? And hence it is in the news that, okay, can this be potentially a variant of concern, right? Why? Because it is seemingly very contagious. It is spreading very fast. It also is causing multiple different systemic symptoms, which I will talk about. And sometimes it is becoming difficult to diagnose because the usual tests which are available that is the home antigen test or the RT-PCR, sometimes is not able to detect this particular variant, right? Sometimes. And hence the reason that a lot of talk is about this particular variant. Now, in terms of symptom presentation, if you see, the symptoms are much similar to all the other COVID variants that we have seen, right? So there is high-grade fever, there is aches and pains, body pain, headache, cough, cold, throat irritation, runny nose, systemic issues such as pain in the stomach or joint pains. These are the common symptoms that are seen, which is true for any other previous variants as well, right? What has interestingly been noted in the last few weeks is that most people who are otherwise healthy, right, those who don't have any long-term chronic illnesses, and even them as well, they are kind of recovering from this. Not many are showing very serious forms of illness. The mortality due to this particular variant, that is XBB.1.16, is very low at this point in time, right? And what was seen was that these were elderly individuals who had other comorbidities, and maybe that was the reason for the unfortunate death, right? But most people by far are recovering from this particular variant. Usually it is seen that people are taking anywhere between, say, about 5 to 7 days to recover. Okay, so it is important for us to understand that this is a possible infection which could be similar, as I said, what we saw during the Omicron variant as well, right? However, we can't let go or be very lax in our attitude, because this is spreading very fast. And what happens when there are a large number of people who get affected? Naturally, those who are immunocompromised or elderly, or those whose immune system is poorer, they will suffer the most because they will have serious forms of illness, right? So we definitely need to ensure that, though at least in India, we are seeing that most people are recovering, we cannot we still need to be guarded about our approach to the current COVID infection. We have to understand that, right? Now, if you do have symptoms, right? So suppose you have fever, or you have cold, cough, or suppose you see headaches or body aches, and you see that there is a pattern that this is continuing for the last, say, about 48 hours, right? 2 days. It is important that you get investigated. It is important that you get investigated. Now, any symptom, I usually tell people that it's a good idea to talk to a doctor, right? Consult a doctor. Figure out what could be the reason for this. Do you have a history of other people around you who might be unwell? Or have you had a history where you have traveled recently and come back, right, or you have been to a crowded place or an ill-ventilated place? It's important that all of you take a consultation with a doctor, talk to the doctor, and if required, in 48 hours, get yourself investigated. Because if you get investigated, it will help you in the long run to quickly diagnose and then get the right kind of treatment. Now, in most individuals, right, the current diagnostic methodology for the COVID-19 infection, even the latest variant, is also the RT-PCR test, right? So they typically take the swab, right? Rather, it will be from your nasopharynx and from your oropharynx, right, through the nose and through the back of your throat, and they will check for viral load, which means, is there a virus, right, or the antigen? And if it is present, then it concludes the presence of the illness. Now, some people, we have seen that the test may evade the diagnosis, and it is important that even if you are coming out as negative for COVID with the RT-PCR, you need to still follow instructions or the advice that the doctor has given you, right? Both in terms of medication as well as in terms of your lifestyle and the advice that they give you in terms of, say, physical distancing and so on and so forth, right? So you have to follow it. Now, most doctors will prescribe you basic medications, right? They don't need any hi-fi medications. Most medications will be basic. Now, if you have fever, they'll give you medicine for fever. If you have cough, for that, cold for that, right? So typically, symptomatic medicines is all that is required. Now, lot of people now jump into taking antibiotics very quickly, right? I see it is very easily available over the counter, but it is important for us to understand that COVID-19 is a viral illness. It's a virus, right? So an antibiotic actually cannot work on a virus, right? It cannot, because antibiotic is basically for bacteria, and bacteria and viruses are two different types of organisms. So refrain from taking antibiotics unless absolutely prescribed by doctors, who may give it to you because they have found a component of bacterial illness, or if they have seen there is a super added bacterial illness that you may have. But otherwise, for COVID-19, you do not need antibiotics. Please understand that. Now, apart from medications, the doctors would of course ask you to take care of your hydration, take care of your nutrition, do home remedies in terms of, keeping your nasal passage open, gargling, taking rest. All of this, the doctor would advise you. Okay. So it's important for you to follow whatever the doctor has advised you. In most cases, as I said, people do get better in 5 to 7 days. Okay. And it's important that, you continue to follow preventive measures, right? If you are in a crowded place, if you're in an ill-ventilated place, or you have symptoms, stay away, follow physical distancing, wear a mask, ensure that you are following hand hygiene, taking care of your lifestyle. These are important measures for you to keep yourself safe and protected and reducing your risk of getting the infection. Now, naturally, as a doctor, I always, it's always a diagnostic dilemma, because COVID also presents with respiratory symptoms. And there is also this illness called H3N2, which is also very much there. It is basically influenza. And that is also very commonly, being diagnosed these days. And we see that a lot of people are also having the H3N2 infection now, right? I'm sure that you have read about that as well in your newspapers, right? So basically, H3N2 is the influenza virus, right? Which is a part of a larger, like how COVID is a coronavirus or coronaviridae. There is another family of viruses we call as orthomyxoviridae, which is again, from that particular family, this comes. Like how for COVID is from another family, influenza is from another family. Now, influenza also is of different types, A, B, C. And the H3N2 is basically a subtype of the influenza A virus. Okay, so that's how it is. I'm sure you have heard of H1N1. There was a large pandemic way back in I think 2009, I believe, 9-10. And it had affected a lot of people that time, right? So this belongs to the same family, right? So H3N2 is one of the variants which we are seeing in the current flu season. And it is also seen to cause similar symptoms, right? Respiratory symptoms, like how you would see with COVID. So typically with individuals who have the H3N2 influenza infection, the symptoms that we see is typically high-grade fever, right? The symptoms that we see is high-grade fever. Apart from that, you will see cold, cough, watery or runny eye. There could be, throat irritation, sometimes body aches, severe body aches and pains. Some individuals will also have gastrointestinal symptom, right? So it's very difficult to kind of differentiate the symptoms, right? And we are seeing currently in the last, say, 8 weeks or so, that both were there, right? In the beginning of the flu season, which is typically the cold weather season, where we saw a rise in H3N2 as well. And now we're seeing also along with that COVID infections as well, right? So it's becoming very difficult to kind of distinguish. However, typically we would say high grade fevers with influenza, not as much with COVID. But otherwise, most symptoms are similar, right? With influenza, there's a rapid onset of symptom quickly. There's very high grade fever. The person will look very sick, face is flushed. There is redness in the eye. Sometimes there could be lymph node enlargement as well, right, in children. And typically, the incubation period is shorter here, right? Incubation period means the time between me getting exposed to the illness to actually showing the symptom is just like about 2-3 days, right? So it's very short. Usually in COVID infections, the incubation period is longer, right? Which means the time that I got exposed to the time that I actually showed the symptom is longer in COVID as compared to in influenza. So you will see if there are people who are falling sick very rapidly one after the other in a household, or say we saw a lot of people during school times, right? All children were unwell, right? Those kind of things have happened are typically because of influenza. Okay. Now, naturally, the course of illness, typically people get better, max say 4 to 7 days, again, similar to the COVID infection as well. But sometimes, say, the cough may persist for a couple of weeks or so, right? But typically they do get better, as say a COVID infection, right? We will say 4 to 7 days. Okay. Now, naturally, here also there is a specified test. There is a RT-PCR test for influenza as well, which is available, and the doctors would take a swab, either through the nasopharynx or the throat swab, and they will look at the antigen titers, and the report is usually given. So if it turns out to be positive, typically here there is a proper antiviral therapy which is very commonly advised. So treatment is basically one is to take care of the symptom presentation, which means that if you have a fever, cough, cold, that is taken care of. But otherwise, there are specific antiviral which is available, oseltamivir, and that is prescribed by the doctor if the diagnosis of influenza is made. Okay. Now, naturally, here also the supportive therapy would include, say, treatment of the fever or the cough or cold or whatever the symptoms that the person presents with, ensuring hydration, ensuring good nutrition. Those are the important things, right? And it's important to know that most people recover again. Most people again recover from this infection as well. But as is with COVID, people who are at higher risk, people who are immunocompromised, people who are in the older age group, they typically, or those who have chronic diseases, they typically show poorer outcomes, right? So they may have serious form of illness, right? Which is again similar to how the COVID-19 infection is as well. All right. So it's important for us to know that the way we can prevent or reduce our risk of getting these viral infections are basically taking care of the tenets that we all know, right? Hand hygiene, masking up, physical distancing, avoiding crowded spaces, avoiding ill-ventilated spaces. Reaching out and taking a consultation with a doctor if you have any symptoms, not to ignore symptoms, rather seeking help early on, right? So those are the typical, preventive measures that we talk of, right? Now it's important for us to know, and I know that there are a lot of thoughts about, what are the different things that we can do with terms of vaccinations. And I want to spend some more time on vaccines before, I can open the stage for questions. But I do see some questions which are coming in. So I would rather take them up first because they may be in line with what I have spoken till now, right? So there's a question which says, adenoviruses also cause similar illness as COVID and influenza. How to differentiate? Fantastic question. Again, most of the viruses are similar in their approach to what infections they cause or the way they present. However, in adenovirus infections, typically adenovirus infections, you will see more in children. That's number one. And number two, it specifically affects a lot of your the throat, right? So the children will present with fever, they will present more commonly with throat pain, right? But they also will have similar symptoms, cough, cold, tiredness, malaise, aches and pains, along with fever, right? But in adenoviruses, typically they affect the throat more. Adenoviruses can also affect our gut as well and cause diarrhea as well. But as I said, it is quite difficult to distinguish between infections of different viruses. All of these do cause the general, as we call it, self-limiting upper respiratory infections, right? So hope that answers your question, right? So now going to going to the next point of vaccinations. I get a lot of questions on vaccines, and I thought that I'll proactively take it up, right? So from a COVID perspective, right, I'm sure all of you are already vaccinated. I hope you are, and you've all had your the first two mandatory doses, and then the third one, which is your precautionary or the booster dose, as we call it. I'm sure all of you have taken it, right? And if you see, all of you must have had finished your booster dose anywhere between last year, June to August, right? Most of you. So it's important that, we understand that there may be a chance that the government opens up for the next dose of vaccine. However, the point remains that the current load of infection that we are seeing is not as high, and also the fact that the body is able to fight the infection better. So at this point in time, I think that is the reason why this next or the second precautionary dose has not yet been opened up in India. Because again, as I say, last time also we opened it about, only after 9 months of the first two doses. And so we will have to still wait it out for the next round of vaccines to happen. But I recommend that, at least children above the age of 12, where vaccines are available, if you haven't vaccinated your children, do get it done so that they have, they have taken their preventive doses. Now, in terms of flu, of course, that for flu, there are flu shots which are available, right? I'm sure that everybody knows about the annual flu shots that they get, influenza vaccination, which is available. And I recommend that it is specifically, of course, it is recommended for everyone to be taken, but specifically people in two categories. One are children, right? Very small children. So children less than the age of 5, pediatricians would say that definitely take it. And elderly people above the age of 60. We tell them that they should get their flu shots done, because their vulnerability to the virus is much, much higher, right? That's the reason why it's a good idea for them. But I usually advise it for everyone, right, as taking an annual shot. Now, a lot of people ask, I have taken my vaccine, why did I still get the infection, right? It's again a common thing, right? Because the thought is that if I have taken vaccine, then I'm protected from getting an infection. So there is a difference in way in which a vaccine works, right? A vaccine is not given to prevent the occurrence of illness. The vaccine reduces the morbidity and mortality, which means the deaths because of an illness and the severity of illness because of the infection. These are the two things which are considerably reduced because of vaccinations, which we have seen, right? After a large population got vaccinated, it also helped in breaking the chain of transmission and reducing the intensity of illness. If you had to look at the way the Delta wave was, from then on, during the Omicron wave and subsequently as well, we have seen that the severity of illness has drastically come down, right? And one of the many reasons could be because of the vaccinations, right? So it's important for us to understand that vaccines, the role of vaccines is this, right? The way we can prevent the illness is definitely by following proactive, preventive measures such as wearing your mask or, washing your hands regularly, or avoiding crowded spaces, physical distancing. So those are the ones which are going to prevent you from getting the illness, right? But the vaccine is going to help you in reducing the severity of illness and the overall death because of the illness in the community. Okay, so that's the difference. Okay. So there's a question about vaccines which says that COVID vaccines have failed to protect people even after 4 doses, and vaccine stains already disappeared. Then what's the use of continuing old virus vaccines? Absolutely. And that's the reason why there'll be newer vaccine, like in flu, right? If you know, we get annual flu, right? And if you're taking the annual flu shot, and if you read the small print, you will see that the flu shot, which comes out, right, typically in the middle of every year, it is against the latest circulating variant of the influenza A virus. Okay. And that is, over a period of time, they have found out, and then they release the new vaccine, right? Similarly, I'm sure, and we should wait for it, because even, it depends on the microbiologists and the people who are actually researching this and working on this, that they will come up with vaccines which will be for the newer variants. And most probably, like how there are flu vaccines available, there could be, regular updation of the COVID vaccines which are going to come out, right? Currently, it is not so. I agree with you, but I'm hoping that it does come out, right? So, as I said, again, the vaccines that we took helped us to reduce the intensity and the severity of illness, and definitely reduce the load of deaths because of the illness in the community. So that is what the vaccines did, and they have helped us in that regard, right? So hope that answers your question, right? So that's how the virus also stays ahead of its game, right? The virus is also trying to survive, in a sense, if I can say that, right? So the virus would want to keep mutating and changing, so that there is nothing, that the counter that we are trying to create for it is not working on it, right? That's how the virus works. So we are hoping that there'll be newer variants of the vaccine as well, which comes out, and so that they will be made available as and when, right? We are hoping for it. Now, there's a question which says, is it possible to differentiate these two without any test? So I'm hoping that the question was related to the earlier one, which is adenovirus and the orthomyxovirus and the coronavirus, right? I think that's what is said, right? So typically, see, the way we can differentiate is only by the symptom presentation, and the symptom presentation can be similar, right? As I said, that in a flu, if you're having the influenza, then typically the fevers are very high grade, okay? High grade fevers and aches and pains are like most major symptoms, but they also have cough, cold as well. Now, in an adenovirus infection, there'll be very high likelihood of having a symptom where there is throat pain along with fever, but they can also have other cough, cold, and other symptoms as well. In the COVID infection, typically the most common symptom would be, along with fever, there would be cold and cough, right? So, but this is not always true. Like, people can show different symptoms as well. So it can become very difficult to differentiate on the basis of symptoms always. So it is best that test is done to figure out what is the virus which is causing it. Having said that, in most cases, because these are viruses and they in otherwise immunocompetent people, which means people who are otherwise healthy, hale and hearty, and able to take care of their symptoms, and are not having any chronic diseases or not having immunocompromised state, they will be able to fight this infection any which way, right? So the treatment line in most cases tends to be supportive, right? Tends to be the in most cases, supportive line of management usually helps that way. But to answer your question, do we can we differentiate it without a test? Nah, that's a difficult thing to do. But symptom wise, you may be able to figure it out, but best is to do the test, right? Okay. Right, I'm just taking a couple more questions because they are done. Can oxygen level check also give alert for COVID now? Again, a great question. See, oxygen level check by itself may not be an indicator for COVID, right? When does oxygen level check help you? When it is a diagnosed case of COVID infection and that one is showing worsening of symptoms, that is when it will help. But it cannot by itself help in diagnosis of COVID. Because really, if there is an upper respiratory and then a lower respiratory infection because of anything, now this can be because of COVID, even influenza can cause it, right? And say even a bacterial infection, pneumonia can happen because of a bacteria also. All of them can lead to a decrease in oxygen levels, right? So by itself, it may not be helpful, but it is a good thing to check if you are a diagnosed case with worsening symptoms, right? And that brings me to a good point that you've asked. That I recommend that most people, if they're able to, they should definitely keep a few things at home, right? So it's a great thing to have a thermometer at home, a pulse oximeter at home, because it helps us to check things and keep our doctors informed when we are at home and recovering on our own, right? If you're someone who has chronic disease, like suppose you're a hypertensive, it's a great idea to have a blood pressure monitor. Or if you're a diabetic, it's a great thing to have like a home glucose monitor machine, because it helps you to keep ahead and check these levels and inform your doctor if there are any issues, so that the doctor can quickly act on. Because many a times you may not be able to go to the doctor and consult because you're unwell, but you can definitely talk to the doctor, and these numbers help the doctor to do their job well, right? So it's a good idea to have a few health related equipments or instruments at home. Okay. There's a question which says, how many vaccinated for H3N2 virus? So see, the vaccine which is currently available is for H1N1, right? There is no vaccine as such available for H3N2. It's the latest variant of or the subtype of influenza A, which is causing a lot of infections in India. But there is no vaccine as such available for this particular variant. However, let me explain, right? Different variants do come in, but more or less there are certain characteristics of a virus which remain the same. So even if you have different variants, by taking the flu shot, right, you may have a cross reactivity or cross cover that may happen. Not always, but it is a possibility. But there is no specific vaccine as such available for this at this point in time. Okay. Great. There's a question which says, we are speaking about vaccines. Are there vaccines for chickenpox, which also tends to spread among children in summer? What is the minimum age for taking chickenpox vaccine? Wonderful question, right? Yes, there are vaccines available for chickenpox, and I think it is a great thing that you brought up, because I think there are vaccines available for a lot of things, which are not the mandatory vaccines, if I can say that, right? Now, in India, because, we have the universal immunization cover and the immunization schedule, which is there available. And there are a lot of new vaccines which have been added there in the universal cover, including the rotavirus and the Japanese encephalitis vaccine. But so like that, there are many vaccinations which are available, but not a part of the regular regimen, but you can take it, right? Depending on, what the pediatrician says. Chickenpox definitely has a vaccine which is available, right? Now, this typically is a vaccination which is given to children in a very young age, right? This is the best thing to do, is to give it as early as possible. Usually between the age of 1 to 2, is when the usual shots are given. But and there's a recommendation these days that there could be a booster as well given maybe at the age of 5 or 6. But between the age of 1 and 2 is when the, as they say, varicella vaccine, right, or the chickenpox vaccine is given. Okay, so there are usually vaccines there are 2 doses. So it's 1 month apart. So between the age of 1 and 2, 1 month apart, this vaccine can be given. And if you talk to your pediatrician, they can definitely help you with this. Okay, adults can also get chickenpox these days. So if you've not got chickenpox in the past, there is no harm in actually taking the the vaccine. Okay, we recommend for children who have missed their doses in the younger age group, which is ideally between the age of 1 and 2. If they've missed it, then they can take it even till the age of 13 as well. Okay, so you can take 2 doses apart. But what happens is a lot of children already get exposed to chickenpox by that age, and they would have it already. But if they've not had it, then it's a good idea for them to get themselves vaccinated. It's a good thing to do. Okay, great. You're also asked, can adults also take the same? Right. Adults can also take the same if they have not had it in the past. Only then, right? So if you have to take as an adult the chickenpox vaccine, then my advice to you is that you check your antibody titers for varicella, which is the chickenpox virus. Okay. Now, if your antibody titers are adequate, that means that you have had the infection in the past. Okay, there is nothing to be worried about. But if you have getting the vaccine, but if you've had it in the past, then you don't need to take it because you have enough antibodies for it. All right. Great. Okay, so there's a question which says, would it like annual flu vaccine? We may have to take COVID vaccine yearly. It will increase vaccine hesitancy because people don't take flu vaccine regularly. Wonderful question, right? Now there is definitely a debate, even as a doctor, and we have definitely a lot of different viewpoints about how these vaccines have to go. Typically, as I say, for flu vaccine as well, the recommendation is definitely to be taken by children below the age of 5, elderly above the age of 60, right? Because they are the ones who are most vulnerable. Anybody can take it, but it is not routinely recommended for people in the adult age group, because it's okay not to take it if you have great immunity and you're able to fight the infection. But what we see is that in the adult age group, now we have a lot of people with comorbidities, right? People who have diabetes and hypertension and heart disease and so on and so forth, right? And their immunity is already compromised on the lower side, correct? And hence it is important for us to understand that vaccine is specifically, the flu vaccine is specifically told for the extremes of age and people who have comorbidities. But because a lot of people have it, we in general advise everyone to take the vaccine. Having said that, it's a call, right? Because it's not a compulsory vaccine. So it's a call that each individual have to take after understanding their own immune system and how they are able to fight an infection, right? Now, going ahead, similarly with COVID as well, if we do end up having it, we're hoping, now it depends on the virus as well, right? We have seen the virus change its forms and itself so much in the last 3 years, right? It is very difficult to kind of predict how a virus is going to be. The H1N1 came in 2009. That was a pandemic. We had another smaller pandemic after that. But then after that, we have not had like a large pandemic about it. Now, COVID, we have been going on a pandemic for the last 3 years. We don't know how this virus is going to behave, right? So the decision or the choice to have compulsory vaccination really depends on the way we will see this virus evolve, so I may not have a very direct answer to your question, but these are the 2 points I wanted to talk to you about: flu as well as about what we look forward to in the future about COVID vaccine. Okay. Great. There is another question which says, if you have got natural chickenpox, is it necessary to take the vaccine now? Is it necessary to take herpes zoster vaccine? Okay. So, okay, great question again. If you've had chickenpox naturally, that means that you have had your antibodies, you have your natural antibodies, which is again, what we see with any kind of infection, right? You then don't need to take the vaccine because you have enough antibodies that you've generated in your body, right? Now, if you've not had the infection is when you may think of taking the vaccine, okay? Now, herpes zoster is basically the same virus, which is the chickenpox virus, but it is a latent form of it, which is staying in your body. So after you have had your chickenpox, the virus can stay in your body in a latent form at the nerve endings. And when your immunity goes down, this can again resurface and it can cause you infection in the form of what is called as herpes zoster. So the virus is the same, okay? So the way you can prevent herpes zoster, I would say, is by keeping your immunity up. Okay, so people who have lowered immunity, people who are diabetic specifically, or who have nutritional issues, they tend to have herpes zoster, and they are typically like this rash which they get in a particular nerve dermatome or a particular area which is supplied by that nerve where the virus is sitting dormant, okay, at the root nerve root end. Okay, so to answer your question, do you really need to take a vaccine if you've had chickenpox? No, you don't need to take it. Okay. There's another question which says, we have many URI causing, why only flu and COVID vaccine succeeded in causing so severe pandemic, right? Wonderful, correct. Exactly, there are so many of them. There's so many viruses, every virus having so many variants. But as I say, that when do we call a particular virus or a particular variant a variant of concern is when their ability to cause infection or their infectivity or the way it spreads is so high, right? Or its virulence, which means that its ability to cause serious form of infection is so high, or that it is evading or it is escaping the known diagnostic or treatment modalities, right? That is when it becomes a concern, right? Otherwise, there are zillions and millions and zillions of viruses around, right? But not all of them are. We live with viruses all around us, on us, in us as well, right? But they don't cause us trouble. But there are only these few who have caused it because of their structure, the way they are causing their infections, and the way they are showing symptoms in a larger population. That's the only reason why they are causing, but otherwise others don't. Okay. So there's a very nice question, which is, when is the best time to take the flu shot? Wonderful, right? The best time to take the flu shot is just at the end of your reigns. So typically October is a good time to take your flu shot. September, October is a good time to take your flu shots, because that's when the flu season will also start, which is typically your the winter months, right? So that's when you would take the flu shot. Great. I'm just looking through if I have any more questions, and otherwise I'll just do. Yeah, I think we are done with all our questions. So let me, I'm looking at time as well. We are also kind of coming to the end of our session. So let me just kind of, conclude it, understand that there are a lot of viruses, right? The ones which are causing us trouble are currently that we today spoke of, the newest variant of COVID, the newest variant of influenza, but understand that they're all viruses. As long as we are able to keep ourselves up and above it, right? Which means we are following the right lifestyle, we are following all preventive measures, we will most probably be able to prevent the illness coming to us, right? So it's important for us to ensure that we do what is in our hand, correct? That's the most important thing. So, right, I again, there are a couple of questions. So, I was going to conclude, but let me just take these as well. If someone already got herpes zoster infection, will they get it again? If yes, is there any vaccine to prevent? So people who get herpes zoster can get it again, as I said, because it is the latent virus which is sitting in your nerve root, which can get activated if your immunity is low, right? So the way that you avoid it is by ensuring that your immunity is strong, you are able to fight the infection. Yes, if you've had herpes zoster, you can think of taking the vaccine, but talk to your doctor, because most probably if you have herpes zoster, then your immunity levels have to be checked first. Okay. Does the present COVID have similar symptoms like taste and loss of taste and smell? It can, though the number of people who are showing the symptom is lesser with the latest latest variant, but it is being shown, right? So that's a possibility, but lesser as compared to the previous ones, like in Delta and all, we had a lot more loss of taste and smell. It's not as much in this particular variant, but it can be possible to show that symptom. How to differentiate if a person has viral fever or fever due to allergy in those who are prone to allergy? Again, very difficult to distinguish, right? If it's a viral fever, then it's a good idea to check what kind of virus, as we discussed. It could be COVID, it could be H3N2, it could be anything else. If it's a allergy, then typically fever may not be the first presentation, right? Allergy, you will have sneezing, running watery eyes, cough. So get yourself investigated, and then you will be able to figure out what is the cause of it. Fever usually in allergy would be because of some infection which is sitting in, because allergy can lead to then lowered immunity, leading to an infection causing fever. All right. There's a question. After I recovered from COVID-19, I'm feeling some changes in my body, like I got some additional effects. Is that possible? Well, that's a long thing that we can discuss about, sir. I'm not sure, due to paucity of time, I will be able to tell you everything. But post-COVID, we are seeing a lot of people with long COVID symptoms, people with cardiovascular or heart-related problems post-COVID. We have seen more people who are now coming up with, chronic diseases, including heart disease and diabetes post-COVID. So it is absolutely during and in long COVID, people with, chronic fatigue, aches and pains, chronic cough. So there could be multiple symptoms that we are seeing that people may present with post-recovery from COVID. I usually recommend, if you've had COVID and post-recovery, typically after about 8 weeks, get a full health checkup done. Check your cardiovascular risk. Get an ECG, 2D echo done if you have not done it. Especially if you're above the age of 30, get it done. Get your basic parameters checked. That get a doctor to review you, so that we know that there are nothing that is kind of shown up because of the COVID infection. A lot of things are coming up post-COVID that is being seen. So if you are seeing any symptom, best is to get a health check and talk to a doctor. Specifically, get your heart evaluated. Okay. Great. So, great. So let me just conclude the session by saying that, important thing for us to understand is that this is not something which we need to be scared about. Okay. I don't think we should be scared about any virus infections. We need to do things which are in our control, right? I keep saying that. So ensure that you go back to your basics, right? Get your lifestyle in order, be it your diet, your exercise, your BMI or body weight, and ensuring that you're sleeping right, drinking enough water, eating balanced meals, getting your health checks done. If you have any chronic diseases, ensure that you are treated well and are monitored well, so that your say your sugars or your blood pressure, or whatever your chronic disease is under control, right? That's one part of it. Second part, ensure that you follow preventive measures, be it using your mask, avoiding crowded spaces or in ventilated spaces, washing your hands, taking care of, covering, your mouth and face when you're, if you have a cough or a sneeze, ensuring that you reach out to people or reach out to a doctor or a healthcare professional if you have any specific symptoms which may be pointing towards a respiratory illness or something in general that you're feeling unwell. Reach out and seek help early so that it can be tackled. All right. So hope this helps you with a few of your questions. I know that I've not been able to answer every question, but I hope that I've covered most of the points. So take care of yourself. Stay happy, stay healthy, and keep smiling. Until next time, this is Dr. Gauri saying